This is Abia COVID-19 update.
Abia COVID-19 update.
Well, as Nigeria's confirmed COVID-19 cases surpassed 13,000, Presidential Task Force on COVID-19 has said that the country may just be starting to experience epidemic. Now, the PTF lamented that Nigerians were avoiding being tested, a situation he said was responsible for the low testing ratio to the population. So it means that people are not submitting themselves for testing. And this was also made known at the House of Representatives when members of the PTF, that's the Presidential Task Force, appeared before a joint committee of the House to account for the funds allocated and donated to the fight against the pandemic. Now, the chairman of the PTF, who is also the secretary to the government of the Federation, Boss Mustafa, expressed uncertainties over the pandemic, urging the lawmakers to help extend the campaign to the grassroots. The Director General of the Nigeria Center for Disease Control, Dr. Chikwe Hiekwazu, while responding to questions also whether the PTF had projected a figure for cases to know when Nigeria has reached the peak of the pandemic, stated that the country was just entering it. So it is very important that we keep staying safe. We've not even reached the peak of the pandemic yet in Nigeria. Don't forget to wash your hands regularly with soap under running water. If that is not readily available, make use of a hand sanitizer. It is very important you keep safe distance. That's 2 meters away from the next person, which is about 6 feet from the next person. It is very, very important. That's what we call physical distancing. And also, you need to avoid touching your eyes and the nose and your mouth, because when you have the virus on your hands, even if you do not wash your hands regularly, you transmit it into your body system when you touch your face. And this point and those entry points, the virus enters your body. Welcome to another edition of the program, Abia State COVID-19 Update. It is the 4th edition for the week, today being Thursday, the 11th day in the month of June 2020. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as the Abia State Governor, Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. The program is running simultaneously every weekday, Mondays through Fridays, on several radio stations in the state, on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Buzz 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now, globally, cases of coronavirus that we have globally as of 11 a.m. today, being the 11th day in the month of June 2020, we have over 7.4 million cases recorded worldwide. That's 7,478,234 coronavirus cases, while unfortunately 419,391 deaths have been recorded. And the number of recovered cases is at 3,792,244. Now let's break it down to Nigeria. The country's tally of confirmed coronavirus cases rose to 13,873 yesterday. That's the country's total tally, as 409 new infections were announced by the Nigeria Center for Disease Control. 17 deaths were recorded from the virus, bringing the total number of confirmed deaths from the virus to 382. Till date, 13,873 cases have been confirmed. 9,070 active cases in Nigeria. That's active cases of COVID-19 in the country. 4,351 cases have been discharged. 382 deaths have been recorded in 35 states and the Federal Capital Territory. It is very important that we need to let you know that these are not just numbers. No, they are humans, human beings like me, and like you. So it's very important you keep staying safe. Since the onset of this outbreak in Nigeria, 82,935 samples have so far been tested. Now, this morning on Abia State Coronavirus Update, we're taking a look at what is being done now that we have a rise in the number of reported cases, confirmed cases of the virus in the country. We will be talking to the chairman of the Nigeria Medical Association in Abia State, Dr. Carol Iwoha, who will be joining us in less than a minute now to talk about the case search. We understand there is an aggressive case search ongoing. We have Dr. Carol Iwoha joining us this morning. Glad to have you join us this morning, Doctor. Hello, Doctor. Can you hear me?
Yes. Yeah, good
Okay.
morning.
Okay, good to have you join us on Abia State COVID-19 update. We
Yeah.
understand that there is an aggressive case search ongoing in Abia State. Can you let us into that?
Yes, with the increase in cases, as you would have noticed, we have 97 at the present. With the increase in cases, there was a need to increase the search for the contacts of these cases. So presently, the local government surveillance notification officer, the local government teams actually that were trained on surveillance and case search have been activated to go searching for the cases, especially in local governments where most of these cases are residents.
How do you go about this case search? Because it is very important that those your men on the field, they need to stay safe because this virus respects no one, including medical practitioners. So how do you go about the case search?
So the case search, you start with what is called a line list of the contacts of the positive case, and then you reach them first on phone, and get to their locations. And remember, these people are not confirmed cases; they are just contacts. And then we also give them personal thermometers to check their temperatures and give us feedback. So, but not just anybody basically goes out for case search. It is you have to be trained on how to maintain the same social distancing we're talking about. You have to be trained on use of personal protective equipment so that you don't get yourself infected in a bid to find cases.
All right, I would like to take you on the issue of training now. It is very important, you will agree with me, that there should be training and retraining of health workers, especially those one in rural areas, to identify the patients from the primary health cares, from the primary health centers that are in Abia State that present that, especially those patients that present themselves with likely symptoms. How have you been able to train those health workers at the rural areas?
Okay, so the state government on its part has done a number of trainings for various cadres of health workers. Currently ongoing is that of the National Primary Healthcare Development Agency, which, of course, there's a state component to it, the Abia State Primary Healthcare Development Agency, which is training health workers from facilities in all the 17 local government areas. So you have volunteers from facilities, staff of respective primary healthcare facilities across the state being gathered together for this training. And the whole idea is to get everybody on the same page with regards to case definition of COVID-19, the signs and symptoms, and very importantly, how to protect yourself as a healthcare worker so you don't get infected. And like you know, the challenge we have in the state presently of people not believing there's COVID-19, we still have that very close to us. But many thanks to our executive governor, who we are praying for his speedy recovery. He's doing well. We thank him for making his status on COVID-19 known. And that is the way it should be. He coming out to tell Abians that this is my situation. I want you all to be safe. I want you all to be careful. Should tell Abians that this is real and that COVID 19 can affect just anybody. Just anybody. It depends on who you get in contact with. If you get in contact with somebody that has the infection, you are likely to also get the infection. So that awareness is what we still want people to know. I listened to a radio station, somebody said what we have is COVID 419, and they were laughing. But indeed, what we have is COVID 19, and it is here with us. And so when we create this awareness among these rural healthcare workers across the state, then we believe that it is also cascading to the populace, to the communities where they dwell, to create that awareness and to also be on the lookout for possible cases.
All right. We've also had reports of suspects. I mean, suspected case. Those with suspected case of coronavirus, especially when you go on the case search, running away from your team.
Yes, we have such stories of people running away, and the appeal this morning is to tell them that there's no hiding place from COVID-19, because the people you're even running to, you don't know if they're the ones that have it, where you're going to hide. So there's no hiding place. Cooperate with health workers as they come on this case search. When we call out people for testing, cooperate and volunteer to be tested. Because if you know your status, if you're confirmed, then we'll talk about isolating you. Now, the whole idea of isolation is in public health, in management of pandemic and epidemic, is containment. Containment means we want to keep you away from other people so that other people don't get infected as you get well. That is the whole idea. So people shouldn't see it as some kind of punishment, some kind of restrictions that is unnecessary. It is just necessary because let's take, for example, New Zealand just declared that they are managing their last case of COVID-19. It is the height of people's cooperation with health systems and governance. It's cooperation that brings that kind of result.
Okay.
As we speak presently, we're headed for an epidemic in the country. If our behaviors, our response doesn't change, then that's what we're heading for. You're told that your case is you're confirmed positive. Please come to the facility so we can manage you, so we can know what your state is. Remember, this is what we also tell people. Most people will get well. But when we have your records, when we know your contact, then we know we can protect for every case that comes forth. You have helped us to protect so many.
Just a moment, doctor. Just a moment. Now, I want you to paint a picture. What happens, for example, a patient that doesn't present symptoms for coronavirus and is running away from your team? And of course, the patient has coronavirus, but you do not know. What are the dangers, and what exactly are those things that the virus can do and destroy in the person's body? I don't know the medical terminology to use at this point.
Okay, the pathophysiology of the disease is such that the virus, the human immune system, for the virus is seen as foreign. So the human immune system responds immediately to start fighting the virus. Now, your response to the virus depends on the capacity of your immune system to respond. And if that's why we say that people that have underlying health conditions have a challenge, because the underlying health conditions limit your ability to respond. But more importantly, in those running away is the fact that they will infect more people. And we don't know, whereas your own case is mild, maybe asymptomatic, we don't know who you're going to infect. You understand?
Okay.
We don't know who you're going to infect. You might infect an older person who does not have the same capacity,
unknowingly,
the same state of health as yourself. Unknowingly. And so we're going to now start recording deaths of those cases, because it is those cases that are prone to dying from the illness. That is why we really need to get everybody to understand. Don't be selfish about it. That your symptoms are mild doesn't mean you cannot infect other people and indeed infect people who may be prone to the severe forms of the illness.
Interesting. Dr. Carol Iwoha, we'll need to go for a break there. We'll need to go for a break now. When we return, I would like to take you on the management of the existing cases. Given the high number that we have now, as it stands, the official figures, we have 97 confirmed cases of coronavirus in Nigeria, and of course, 16 recovered in Abia State. So I would like to take you on the management of the existing cases when we return after the break. It is still Abia State COVID-19 update live on several radio stations in the state: Flow FM, BCA FM, Vision Africa Radio, Buzz FM, and Real FM.
This is Abia COVID-19 update.
Abia COVID-19 update.
Well, thank you very much for staying tuned. It is still Abia State COVID-19 update, live on several radio stations: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. And of course, we're talking about coronavirus in Abia State. The case management now that we have a high number of coronavirus. In fact, in my opinion, I think it came as a surprise, maybe unexpected to the doctors. But that we will get to know as we have Dr. Carol Iwoha. She's the chairman of the Abia State Nigeria Medical Association, Abia State chapter of the Nigeria Medical Association. And of course, she has been at the forefront. In fact, the chairman of the subcommittee concerning the inter-ministerial committee on the COVID-19 in Abia State. All right, Dr. Carol, welcome back. Can you hear me?
Yeah, I can hear you.
Okay, now I would like to take you on the management of the existing cases. Now, to journalists, when we reported it, it came as unexpected. So I don't know how you received the news. Of course, I'm sure that you got those patients just before the NCDC did reported those cases. So it came as a surge, some sort of surge to journalists when we received the news of over 60 confirmed cases in Abia State in just a day.
Okay, thank you very much. Well, yes, it would have come to journalists as a surge, but one gap that we've noticed in NCDC is that they don't announce the results real time. For example, out of the 67, 17 results were received earlier, and some of them had already coming into the isolation before these 67 were announced. So they have that challenge. But for us, bottom line is the fact that if you test more people, you will find more cases. So it's a factor of the number of samples that were sent. If you send more samples, if you're testing more people, then you're going to get more results. And so this is why we're saying that Abians should not go to sleep. Nobody should ignore the precautionary measures that we're saying they should take. The government is harping on it, health workers are harping on it. They should listen very carefully, because we still have outstanding results. So we're likely to get yet more cases.
So you're saying that it is not yet Uhuru?
No, it's not at all. As a matter of fact, we're really in the midst of community transmission. That's where we are. We're not even talking of people that traveled from Lagos and came now. We're talking about people that are here, that are spreading it from person to person. So as the result, as we send samples, as the results turn out, we're going to be getting more cases. I don't know if that will help Abians to understand that this is a problem we need to attack head on and collectively indeed. That every man, every woman, every young boy, every young girl should please take responsibility. When we tell you put on your face mask, it is to protect you and the people around you. So that is where we are. We are expecting more cases, seriously.
Thanks to God, we've not reported any death in Abia State. Unfortunately, a neighboring Imo State did reported one person dead yesterday from complications of coronavirus. Now, we want to know, in that case, we want to know how are the patients at the isolation centers doing in Abia State?
The patients are doing very well. As a matter of fact, one of the cases that came that looked really serious when he came in, he has done so very well. So that again is a positive message to our people that if you present yourself for care, you will get the right care and you will be nursed back to health. Government has provided the necessary medications that you need to be nursed back to health. So why shy away? Why hide away? Why try things within your confines? Why allow, and again, that is one thing that bothers me in healthcare delivery, why allow just anybody out there to manage your health when there are professionals that have been trained, that are on ground to manage you? Why do you just allow anybody out there to manage you? So we're appealing, if you have a positive case, present to the facility so we can examine you. There are so many people that are hypertensive that don't know, so many people that are diabetic that don't know. So all these will be ruled out when you present at the facility and you can be managed back to health.
All right, just before I let you go this morning, Dr. Mrs. Carol Iwoha, a message here says from Chima says, can someone who has coronavirus, who has been treated, contact again?
Well, that is one issue that the research is still ongoing. There are studies that believe that you can get infected again. There are studies that believe you may not get infected again. But bottom line is there's still that conflict of findings. More research is still ongoing. So that is why even if you get well, we still advise you
To stay
continue
safe.
taking the yes. Stay safe, yes.
Okay, all right. I do really appreciate your time this morning, Dr. Carol Iwoha, for being part of the Abia State COVID-19 updates for today.
Thank you very much, Michael.
All right, that's Dr. Carol Iwoha there. She's the chairman of Abia State Nigeria Medical Association, Abia State chapter of the Nigeria Medical Association. I would like to get reactions just before we wrap up things here this morning on Abia State COVID-19 update. 0808 182 6949 or 0811 605 2949. Good morning to you.
Good morning, Victor.
Good morning. What's your name?
My name is Iwako Chidebe. I don't really have much to say, but to plead with our security men. My cousin left Enugu to Abia State. That was 2 days ago. I had to tell him that I am under isolation so that I would not see him. It's too bad. Come tell me that somebody will come from Enugu to Abia, and nobody stops him until he gets to Abia State. When there is still interstate lockdown, they should please help out the state government. Coronavirus is sure. Stay safe. Thank you and God bless you.
All right. Thank you for your contribution. 0811 605 2949. Good morning to you.
Good morning, Mike.
Good morning, Loman the Prophet.
Good morning, our madam in the house.
She's not in the studio. Good morning to you.
Okay. See, now, when Ebola came, they will say, oh, do this and this and that, it will help. But know that this coronavirus will not change anything they say, okay, try this locally, and at least it will help you. But what we are just, everybody is just waiting for World Health Organization vaccine. At the end of the day, we are not seeing anything, and the number is increasing. We need local-made medicine so that we can reduce the number. Thank you very much.
All right, thank you for your contribution. All right, that's how far we can go this morning on the program Abia State COVID-19 update. Many thanks to the partnering stations of BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. It is very important that you keep staying safe. Social distancing, very important. The use of your face mask, very important. Washing your hands regularly under running water or use of your alcohol-based hand sanitizer, also very important. My name is Michael Oni. The program returns tomorrow, which will be the last edition for the week.
This is Abia COVID-19 update.
Abia COVID-19 update.